Do you have that pain in your back?
I am shocked. I am pleased beyond all get out. I woke up this morning and I literally almost screamed and said, oh my God, my pain is gone.
Gone.
Gone. I mean, like 100% gone. I haven't had that kind of a day in over 8 years.
Okay, Dr. Deuk, I'm here with one of my patients who came to us for treatment of her back pain, and you just had surgery yesterday with us. What did you have done yesterday for your back pain?
I had my L2, 3, 4, 5, both the left and the right side done, and then my S1.
Okay, and what do we do? What kind of surgery?
Laser surgery.
Yep, the Deuk laser disc repair. And we did 2 discs on one side and we did 2 discs on the other side. So we talked a little bit about when all this started, and you were thrown from a horse very aggressively 40 years ago.
Right.
And that's probably when the injury occurred.
Correct.
And so you had pain on and off, which is typical of the behavior, pattern of behavior for the inflammation in the disc.
Right.
But then 8 years ago it got constant.
Got constant because I broke my hip, and then it threw the rest of my body completely off, and then everything in my spine got significantly worse, and then I walked totally with a limp, and I injured myself even more within my lumbar area.
Now, you didn't just have back pain from L2 to S1, you also had pain going from your back down your legs, correct?
That is correct.
Both sides.
Both sides.
You still have that leg pain?
I do not have the
Gone.
leg pain. It's just amazing.
Yeah. And the reason you don't have the leg pain, because I carefully studied your MRI images, the actual pictures, and not your MRI, your CAT scan, and I looked carefully and I saw that 2 of the discs were really on the right side and 2 of the discs were really on the left side. And so by going on the right side for 2 to fix them endoscopically and going on the left side for the other 2 to fix them endoscopically, I was able to get rid of the back pain at all 4 discs, which, by the way, do you remember what pain level you were during surgery?
Yes, I controlled myself, to tell you the truth, and I went with an 11, but I really wanted to say 2 million
Yeah.
and 11.
So
Yeah.
when we did our discogram to decide whether or not the discs were hurting, they were the source of her pain, because the discogram is the only test that really tells you. I make a very educated guess based on the physical exam and where the patient points their pain is. That's very helpful, but also the MRI or CAT scan can also guide me, because where the patient points, I go back and look at the CAT scan or MRI and I can see there's herniations there. So that kind of confirms. And then in the operating room, we do a discogram, which really tells us if that disc is causing pain. And in her case, all 4 discs, L2, 3, 3, 4, 4, 5, 5, 1, were indeed causing severe pain. And it was the type of pain she feels every day. We call it concordant pain. And I gave her the opportunity to tell me how severe it was on a scale of 1 to 10, 10 being the worst pain, and it was 11. So all 4 discs were 11 out of 10.
Right.
So that was very reassuring for me as a surgeon, knowing, hey, we're treating the right discs that are causing her back pain. We were confirming that in the operating room. And that also allows me to look at the architecture of the disc, and you could see the tears that were happening in those discs in the back. And so I felt really good because I could see the tears that I needed to repair to get rid of her back pain. And I confirmed that she had back pain from all 4 discs and that it was severe and that it was her typical pain. Mm-hmm. And so going in, we had a very successful procedure. Here you are 12 hours later, back at Deuk Spine, and you're out of pain.
I'm totally out of pain. I mean,
Yep.
It's the best day I've had in many, many, many years.
Yep. So one day after surgery, and could you drive today if you wanted to?
Oh yeah.
Yeah. You walk, you drive, you shop, you eat, you can do whatever you want. You
Right.
just can't bend over and pick things up.
Right.
So you feel like a new person.
I do.
Yeah, that's
I
awesome.
almost wanted to run here.
Yeah, I heard your husband was telling me that you were walking with a
great
cadence
cadence.
that was very brisk. And so, I mean, just less than 24 hours later, walking and feeling great and doing great. Now, just for note, we didn't give you oxycodones or oxycontins. You're not on any narcotic painkillers for the surgery, are you?
No, and number one, I wouldn't want that. Number two, I flat out did not need it.
Yeah.
I had no need for something that harsh, and I wouldn't want to put that in my body anyhow.
Yeah, so our patients take usually Tylenol or an anti-inflammatory and a muscle relaxer, and that's it. So no dangerous narcotics or anything like that. Very safe recovery. You're already recovered. You're up and around. You're going home.
Right.
Anything else you want to say to our audience?
I thought it was extremely interesting that probably from my horse throwing me 41 years ago, that my S1 was, what did you call it? Like crystallized or
Calcified.
calcified. And just how severe that was in my body for so many years, and that's what it did, calcified,
Yeah.
like a mummy.
When you injure a disc, the longer the inflammation in the disc goes on over years, the more dystrophic calcification occurs in that pathological tissue, and the more calcified it gets. So, but we still were able to fix it.
I know.
Yeah, despite how degenerated her discs were, they were fixed. So, anything else you want to say?
I'm surprised that I remember as much of the dialogue that we had, but I was out too, so I'm quite surprised by that.
Yeah, you had outpatient surgery. You were
Yeah.
completely out for the second half of the surgery, but awake in the beginning, helping me to localize the source of pain. And the whole surgery took us about 2 hours. So 2-hour surgery, 1-hour recovery, outpatient, and here you are, less than 24 hours from the surgery, and you're up being normal.
Yes.
That's what we want.
Well, I
Congratulations.
am extraordinarily thankful for you.
You're welcome.
It's been great. And if anybody has back pain, I just highly recommend you.
You're welcome.
I mean, you're the one in a million.
Thank you. Thank you very much.